What if the most dangerous threat to your heart isn't your cholesterol, your diet, or even your age, but something you take every day without a second thought? Hidden inside your medicine cabinet could be pills that, while meant to help, are quietly weakening your heart over time. Millions of seniors rely on daily medications for pain, sleep, blood sugar, or mood. But here's the shocking part. Some of the most commonly prescribed drugs are linked to heart failure, high blood pressure, or even deadly arrhythmias. And the side effects don't always show up right away. They build up quietly, year after year. In today's video, we're exposing 7 common medications that could be silently harming your heart if you're over 60. If you or a loved one is taking meds daily, don't miss a single second of this video. The most dangerous pill, like one taken by millions of seniors around the world, is revealed at the end. Let's start the countdown. Pill number 7, NSAIDs, non-steroidal anti-inflammatory drugs. These include drugs like ibuprofen, naproxen, and even aspirin in some cases. They're marketed as safe, everyday pain relief for arthritis, back pain, or joint stiffness. But the hidden danger? NSAIDs can raise your blood pressure, increase fluid retention, and over time, strain your heart. They also reduce kidney function, making it harder for your body to regulate blood pressure and fluid balance. Seniors who already have heart issues or even borderline high blood pressure are especially at risk. Many think that because they're sold over the counter, NSAIDs are safe to use long term. But using them daily for weeks or months can increase your chances of heart attack or stroke. If you're regularly using NSAIDs, speak with your doctor about alternatives like topical creams, gentle stretching, or medications with a better heart safety profile. Pill number 6, diabetes medications, thiazolidinediones. If you have type 2 diabetes, you may have heard of drugs like pioglitazone or rosiglitazone. These thiazolidinediones help improve insulin sensitivity and lower blood sugar levels. But there's a major catch. They can cause the body to retain fluid, leading to leg swelling, shortness of breath, and in some cases, congestive heart failure. Why is this especially concerning for seniors? Because many older adults already have compromised heart function. Adding extra fluid into the body puts pressure on an already aging heart. And what's worse, these medications can mask the early signs of heart failure. So while you're managing your diabetes, you could be silently damaging your heart. Always ask your healthcare provider if a safer, newer medication is available for your condition. Pill number 5, sedative sleeping pills, hypnotics. Poor sleep is a common complaint among seniors, and medications like zolpidem, Ambien, diazepam, Valium, and lorazepam, Ativan, are frequently prescribed. These pills may help you fall asleep faster, but at what cost? Sedative hypnotics depress your central nervous system, which slows down not only your brain but your heart as well. Over time, they can worsen sleep apnea, a condition where breathing temporarily stops during sleep. Sleep apnea puts enormous pressure on your heart, especially at night when your body is supposed to be recovering. These medications can also blunt your heart's natural response to oxygen dips, leading to irregular rhythms. Long-term use has also been linked to increased confusion, dizziness, falls, and even memory issues, risks that multiply when mixed with other medications. Good sleep is essential, but there are safer, natural approaches, like sleep hygiene routines, melatonin, or cognitive behavioral therapy that don't compromise your heart. Pill number 4, tricyclic antidepressants, TCAs. These older antidepressants, such as amitriptyline and nortriptyline, are still commonly prescribed for depression, anxiety, and even chronic nerve pain. While effective, they come with serious risks, especially for older adults. TCAs affect the heart's electrical system and can cause arrhythmias, blood pressure changes, and something called heart block, where electrical signals are slowed or stopped. Seniors with pre-existing heart conditions are especially vulnerable. They also increase the risk of dizziness, blurred vision, constipation, and falls, complications that can severely impact quality of life. If you or a loved one is on one of these drugs, talk to your doctor about safer, more modern antidepressants that don't carry the same level of cardiovascular risk. Before we continue, here's something vital. If you or someone you care about takes multiple medications, tracking side effects can be life-saving. That's why we recommend downloading the Senior Health Tracker app. It helps you record your medications, symptoms, and catch dangerous interactions early. It's designed specifically for seniors and free to try. Find the link in the description or pinned comment below. Pilner 3, decongestants, pseudoephedrine and phenylephrine. Got a stuffy nose? Most people reach for over-the-counter decongestants, especially during allergy or flu season. But seniors beware. Medications like pseudoephedrine and phenylephrine narrow blood vessels, not just in your nose, but throughout your entire body. This narrowing raises blood pressure and forces your heart to pump harder. If you already have heart disease or high blood pressure, this can trigger palpitations, chest discomfort, and in rare cases, even a cardiac event. These pills can also cause anxiety, tremors, and insomnia. Always consult your doctor or pharmacist before taking cold meds, especially if you're already on blood pressure or heart medications. Pilnar 2 proton pump inhibitors, PPIs. These include omeprazole, pantoprazole, and esomeprazole, common solutions for acid reflux and heartburn. Millions of seniors take them daily, often for months or even years. While PPIs are effective at reducing stomach acid, long-term use has serious downsides. These drugs interfere with your body's ability to absorb magnesium, and low magnesium can lead to muscle weakness, fatigue, and irregular heartbeats. They also reduce calcium absorption, increasing the risk of osteoporosis and fractures. Worse, PPIs disrupt gut bacteria, contributing to systemic inflammation, which is a major factor in heart disease. If you're taking PPIs daily and still experiencing heartburn, it's time to get to the root cause. You might need dietary changes, lifestyle modifications, or a safer treatment strategy. Pill number 1, calcium channel blockers, CCBs. Finally, the most dangerous pill for senior hearts. Calcium channel blockers, particularly older types like verapamil and diltiazem. These are used for high blood pressure, chest pain, and arrhythmias. They work by relaxing blood vessels and reducing the workload on the heart. Sounds good, right? But here's the catch. They can also slow the heart too much, especially in older adults. This leads to dizziness, fatigue, fainting, or even heart block. They may also cause swelling in the legs, shortness of breath, or interactions with other medications. Often, these side effects are mistaken for aging, not the medication. If you're taking a calcium channel blocker and notice any of these symptoms, ask your doctor for a medication review. There may be newer options that provide the same benefits with fewer risks. If you're over 60 and taking any of these medications, don't stop cold turkey. But do speak with your doctor, ask questions, request a medication review. These pills may have been necessary at one time, but as your body changes with age, so should your treatment plan. Too many seniors end up in the hospital not because of disease, but because of overlooked side effects. You deserve to feel better and safer. Take charge of your health. Use tools like the Senior Health Tracker app, be proactive, and share this video with your friends and family. The more people know, the more lives we can protect. Stay safe, stay strong, and keep your heart healthy.